Hello, everyone. Welcome to the second installment of the Sickle Cell Disease SOAR series. My name is Captain David Wong. I'm a pediatrician and the senior advisor for sickle cell disease in the Office of the Assistant Secretary for Health. Next slide, please. The Sickle Cell Disease SOAR series is a new virtual series that we started this summer designed to enhance quality of life for warriors and their families. Our first session in August was on mental health, and today's session will be on affordable housing with the U.S. Department of Housing and Urban Development. Next slide, please. For the agenda today, we're going to use our typical agenda, which is to start every session with a warrior or caregiver TED Talk for about 10 minutes. Then we'll get into the meat of our discussion, which is the featured agency and resources from HUD. And we hope to have about 20 minutes at the end for questions and answers. Please enter your questions in the Q&A box that you see at the bottom of your screen on the right. And we'll try to answer as many of the questions as we can live during this event. Afterwards, we'll be sending a copy of the slides and responses to questions that were not answered to all attendees. And please keep in mind this event is being recorded and it will be posted to the HHS YouTube channel. Next slide, please. So before we get started, we just wanted to check and see who's here in the audience today. So we have a polling question that we're going to pull up. And I know some of you wear different hats, so you only can answer a single choice. So choose the best answer that represents you today. And we'll give folks about 10 seconds or so to answer this question. All right, and maybe we'll close and see what we got. Okay, so again, a nice mix of folks from the warrior community, CBOs, health providers, and others. So thank you so much. All right, next slide, please. I'll go ahead, next slide, and we'll go ahead and get started with our program. So it's my honor to introduce our TED Talk speaker for today, who is Ms. Pamela Phillip from Austin, Texas. She's a mother, caregiver of an adult daughter with sickle cell disease, and she's been a recipient of public housing vouchers in Austin since 2003. And I'm really grateful that Pamela has agreed to share her story with us here today. So I'm going to hand the mic over to her now. Thank you.
Good morning, everyone, and welcome. My name is Pamela. I'm originally from Gonzales, Texas, a small town about 70 miles south of Austin. I currently live in Austin with my boyfriend, Terry, and my beautiful youngest daughter, Princess. Princess is 33 years old. She was born and diagnosed at birth with sickle cell anemia, SS disease. At age 4, Princess suffered a massive CVA stroke. At age 5, she had a minor stroke. Since the first stroke, she has currently and is been receiving monthly blood transfusions. At age 13, she had a brain surgery. The goal of that surgery was to decrease her chances of ever having another stroke. And so far, it's been a big success. She hasn't had a stroke since that last stroke at age 5. We have been truly blessed by God and have a wonderful team of medical professionals on our journey, which isn't always the case, meaning sometimes you have to, as a mother and an advocate, you have to help educate doctors, school staff, etc. about sickle cell anemia. We're so thankful to God and to sickle cell anemia the Sickle Cell Anemia Foundation, Mark Thomas chapter, for all the love, education, and support they provide here in Austin and surrounding area. In the meantime, not only have I had to navigate the complex healthcare maze for my daughter, I am also a strong advocate for both of us and know firsthand the complexity of securing affordable, safe, and stable housing in today's housing market. In addition, I have benefited from several U.S. Department of Housing and Urban Development HUD programs, such as the Section 8 voucher program since 2003, and the Family Self-Sufficiency Program since 2018. With that said, I believe some people tend to shy away from Section 8 and other similar programs because of the negative stigma and simply a lack of knowledge regarding available programs and resources. Looking back, I can say that I am truly grateful for the assistance I have received and still receive, and it has enabled me to earn 2 degrees and save some money. And looking forward, I'm currently working on my memoir, and it's now in a position to consider becoming a first-time home buyer. Furthermore, I know all too well the overwhelming challenges of being a single mother and a devoted caregiver. I know firsthand what it's like to stand in a long line, and I know what it's like to have your name on a waiting list for housing. And it seems like when you check in with housing on the waiting list, the line gets longer by the week, and your name seems to get further and further down on the waiting list. I know what that's like. However, I also know the joy that comes in the morning when everything works out well. We're all in this together. It really does take a big village. There is help and resources available. You are not alone. Thank you so much.
Thank you so much, Pamela, for sharing that story. And it is so heartwarming to hear that you were able to secure public housing vouchers, get off the waiting list, get on the right path for a higher station in life. So thank you for sharing that story. And I hope that you'll be able to stay on afterwards. I'm sure folks might have some questions about your individual story. So thank you for joining us today. Next slide, please. And so with that initial story and stage setting, I want to now turn over the mic to Jason Amarhaji, who is with the Office of Public and Indian Housing at HUD. And he's going to share an overview about HUD as well as some of the supportive services that they provide. And I'll just say by way of introduction that I know Jason for 5 years. He taught me everything I know about public housing. I was fortunate to work with him on a project when I was at the Office of Minority Health, looking at CHWs in public housing. We met in Los Angeles at the Housing Authority of the City of Los Angeles. And I'm really grateful that Jason has taken the time today to share some of his knowledge with the sickle cell community today. So with that, I'm going to hand the mic over to you, Jason. Thank you so much.
Thank you, Dr. Wong, and thank you, Pamela, for sharing your story. And I know how difficult it can be to share those things, especially with a broader audience, but also how important it is. And I think that's one of the themes that we'll come back to in my short presentation here about HUD programs and the best way perhaps to leverage those programs to better serve community is that oftentimes the best advocates for screening, treatment, care are those who have lived experience within community. And in many cases, those are folks who reside in HUD-assisted housing. So if you're a medical provider or someone who is looking to reduce the incidence of any type of disease, but also perhaps to increase awareness about something like sickle cell, to increase screening and treatment, it's a great opportunity to partner with housing agencies and housing providers to do so. Let me also thank you, Dr. Wong, for having me. You mentioned a little bit the Community Health Worker Project, and I'll talk about that in a moment. And I think the work that Pamela is doing is a great example of the value of community health workers. We really believe in that model, and I'll share some of our programs that could help to support community health workers. And if it's something that you haven't already considered, which is to identify, recruit, hire, and train someone from community to serve in that role, I hope Pamela's story would encourage you to think about ways to do that, and that you also see myself and the team at HUD as a resource to help connect you with those local housing authorities on the ground and housing providers on the ground that you could partner with to do this. So if you could go to the next slide, I'll just give a quick overview of HUD. Folks may be familiar not so much with HUD as an agency, but most likely with your local housing provider. So in most communities throughout the country, there is a public housing agency, or we call them PHAs. And those are public entities that manage, in many cases, public housing, in most cases also voucher housing, which is referred to as housing choice vouchers or Section 8. And in addition to those public entities, we also have some private and nonprofit entities that we call multifamily owners. And those can be organizations that are nationwide or as small as maybe someone who owns one building. And the units are maintained with affordability similar to public housing or voucher housing. And those are scattered throughout the country. So they're different than PHAs, they're different than Section 8, but they house more people than our public housing and voucher programs. So I would encourage you to think about working with them as well. HUD serves a lot of different folks, including people who are experiencing homelessness. We have special population programs for people who are diagnosed with HIV/AIDS, for example. So there's many different HUD programs. I'm only going to touch on a few today that I think are prime opportunities for partnership, but I'll also share some resources if you want to learn more, and please encourage you to reach out to me or anyone at HUD in your local field office, your local housing agency or housing provider if you want to learn more. So we talk here about housing as a platform for health. Next slide, please. And, just to give the context of why we see it that way, we have about 10 million people that we serve nationwide with housing assistance. These are folks by and large who are low income, very low income. We have different types of housing, including housing that's set aside for elderly and disabled folks. We have even HUD supports tribal housing in Native communities, and we support many, as I said, special populations. But as you can see, we serve also 4 million children. So Pamela's story about her daughter, that really hits close to home because many of our families in public and assisted housing are led by women with children, in many cases, single mothers with children. And the resources can be very difficult to come by. So, despite the fact that there may be a federally qualified health center or community health clinic nearby, it's not always the case that there's a strong partnership or that folks have access to care there. Oftentimes, we know that folks might just have to, by necessity, go to something like an emergency room or urgent care, and that may not be a place where they would be able to get, high-level screening for things like sickle cell. So you can see with our 10 million folks that we serve, that only actually meets about 1/4 of the need nationwide. Unfortunately, unlike things like Medicaid, Medicare, Social Security, housing assistance is not an entitlement. There is no federal guarantee as of yet that says anyone who qualifies for assistance must receive it. And that's why, as Pamela mentioned, unfortunately, there can be waiting lists for people to receive housing. In some areas, especially high demand, high cost areas, those waiting lists can stretch for very long periods of time, decades even. Some places even close their waiting list when they have too many people that are on it. There are some local flexibilities that allow for preferences for special populations. So a housing agency may determine that as a special population, for example, they will prioritize people who have sickle cell disease. That's not a requirement, and that depends on, the individual agency, but it's certainly something that you could discuss and advocate for in your community if you know that there's a high population of folks who are in need of affordable housing who are also afflicted with sickle cell. Just in general, next slide, please. Again, I mentioned these three different types of housing, public housing, which we consider place-based housing. So that is housing that is generally all in one area. There's oftentimes a central sort of meeting space, community space. In many communities, they actually have clinic space that's set aside either for a partnership with a health center or with another community partner. And the advantage of a place-based community is it's very easy to serve folks, on site. So delivering on-site services there, if you can partner with the agency, and most of these agencies would have what we call a resident services department or social services department. That can be as simple as just coordinating and showing up on site, and you'll be able to serve it, anyone who is there. Housing choice vouchers are different in the sense that folks can choose where to live. So they take their voucher and they find a suitable property to live that meets the sort of safety and rent requirements. And then they live in that property and they can choose to change where they live. So they can be scattered all throughout a community. It can often be harder in a certain sense to reach folks who have vouchers, even though they may live in higher opportunity areas. So there's a challenge there, but also an opportunity to work with the housing agency or the city or municipal partner who issues those vouchers and would be able to send out communications, for example, put information in rent mailers, send something in a newsletter. In some cases, there are even service coordinators that work with residents who are receiving vouchers, including the Family Self-Sufficiency Program, which I help to run, and I'll talk about a little more in a moment. And then again, multifamily housing, because it's private and nonprofit operated housing, there's many different types of entities. And so oftentimes people will see housing that they think is public housing, but in fact, it's owned by a private owner. And more that's becoming the case. So, in those instances, they often will work with a management company, but they may also contract out to do resident services. And in some cases, those entities will have grants that I'll talk about in a moment that can help to serve folks in the community. Next slide, please. So our mission primarily, HUD is a housing agency. We help to support and provide funding for that affordable housing across the country. We run the nation's largest voucher program, which is the Housing Choice Voucher Program. There is something unique about HUD, which is that we work actually in many cases directly with communities on the ground. So a lot of other federal agencies work through state intermediaries. We generally do not. So there are HUD field offices in every state in the country, in most large major metropolitan areas. And those field offices can also be resources if you don't really know where to start in your community, but you want to reach out and partner with the affordable housing provider. The HUD field office in your community can be a great place to start. So, given that we are a housing agency, why health? Well, one reason is it aligns with our strategic objectives. I mentioned, of course, the priority around housing as a platform for opportunity, including health. And, we are invested in the success of our communities. We understand that health is a barrier for many folks in terms of, having better life outcomes, improving their educational attainment, their career outcomes. And so, ensuring that folks have access to healthcare is important, but also we know that healthcare is a growing field for employment. And so having someone start out as a community health worker, perhaps, move into roles throughout their time in working with healthcare. So, we've seen people start out as a community health worker, move into nursing, even move into other sorts of medical technical training, specialization, and end up establishing a career in the medical field. So we see the partnership with health providers not only to help serve residents, but also to offer them access to opportunity. And as I mentioned, we believe that residents can be the best advocates in their communities, as you heard from Pamela. So next slide, please. I don't really need to probably explain the social determinants of health to many of the folks on this call, but one thing about HUD is it really does bring together all of these. So, where you live defines your neighborhood and built environment. It also really helps to determine your social and community context. We have a whole office of healthy homes and HUD that works on ensuring that there's no lead in the pipes, that there's no, things like lead in the paint, asbestos, mold, pest issues that could cause asthma. So we're really focused on ensuring the health of the home and therefore the family who lives in it. We have programs that promote education, both for youth and adults. And a lot of our programs are focused on economic stability. So we sort of house all of the social determinants within HUD, but we can't do it alone. And so we have to partner with folks like HHS, but on the ground specifically with health providers to ensure that we can serve folks who are in HUD-assisted housing. Next slide. Okay, so that's just a brief overview about HUD. Now a little bit about where I am and why I'm here today. So I'm part of an office that is called the Community and Supportive Services Team, or we call ourselves the CSS team. You can essentially think of us as the people at HUD. So we are the people who work on the people programs. Most of HUD is focused on what we might call bricks and sticks, bricks and mortar. It's, making sure that the housing is being built and maintained, but we're focused on, in our office, ensuring that people who live in housing have access to opportunity and resources and services. So our programs are generally focused in that area. Next slide. You can see here one of our programs, which is called HUD Strong Families. I mention this because HUD Strong Families is an unfunded program, but because it doesn't receive direct HUD funding, many communities have a HUD Strong Families program, even if they don't have any of the grant programs that I'm going to talk through in a moment. So first place to start, if you're interested in working with your local housing provider to better serve residents there, and particularly to screen and treat something like sickle cell, would be to look for your local HUD Strong Families program. It may be called different things in different places, but you can see here, this is a photo of one of the sites in their Strong Families program. And Strong Families is built around those three pillars that you can see: education, health, and economic empowerment. The goal is to empower families, including, mothers, fathers, children, the whole family. And they do that with things like events. So a lot of places will do Mother's Day, Father's Day events, back to school backpack giveaways, turkey giveaways, and holiday giveaways right around this time of year. And those events can really be powerful opportunities to recruit and meet folks in the community, whether it's for things like a community health worker role, or just to maybe get the word out about the services that you offer and to help folks find a patient home, maybe to raise awareness about an issue like sickle cell, or give folks better access to screening and treatment. So HUD Strong Families programs are all over the country in almost every community, and that's a great place to start. Next slide. This is just a map of where our funded programs are. So I'm going to talk very briefly about our funded programs. I mentioned the Family Self-Sufficiency Program, or FSS, which is a program that I help to run. There's also a program called Jobs Plus. We have a program called Resident Opportunities and Self-Sufficiency. I'll talk about the difference between the three in a moment. And then we have Connect Home, which is a digital equity initiative. So you can see here the distribution really sort of mirrors the distribution of the population across the United States. There are, of course, some areas where there may be fewer resources, like you might see a hole there in Wyoming. But most states also have statewide housing agencies, especially in rural areas, that can serve folks that may be outside of metropolitan areas. And we have a whole separate office within HUD, which is the Office of Native American Programs, that works with tribal communities. And there's many, specific programs for tribal communities, such as the Indian Health Service, for example. So we serve about 3,500 public housing agencies, and we serve tens of thousands of multifamily owners. Our funded programs, reach about 700 to actually, now we've increased to about 1,000 of those sites. So I mentioned HUD-Strong families as something that can exist with or without funding, but these, 1,000 funded sites are places where we fund generally resident services staff, such as a service coordinator, who their main and primary job is to partner with folks locally to better serve residents. So they are, in many cases, required to or encouraged to find, identify, and partner with health partners, other types of community partners. And so they are eager to partner with you, and they also serve a population that in many cases may really overlap with folks that you are trying to serve in community. So we think that there's just a natural opportunity there in partnering with these funded programs. Next slide. And I'll mention, Pamela spoke briefly about the fact that she's part of the Family Self-Sufficiency Program, which I think is great. That is, again, the program that I helped to run, so I'm a little biased, but I think it offers some pretty cool incentives, and I'll talk about those in a second. This just gives a brief overview of our different programs. You'll see that FSS and Jobs Plus in particular are programs that are focused on employment. And one thing to keep in mind, generally speaking, is that the rent that you pay when you are in HUD-assisted housing is typically income-based, not always, but typically income-based. And so the standard is 30% of your income after sort of adjustments and deductions, things like that, goes toward rent. So on the one hand, that's a good thing because it means if you don't make much money, that your rent will not be very high above what might be a minimum rent of $25 or $50 a month. However, on the other hand, this can create a disincentive for folks to access higher opportunity. So if you think about somebody who, let's say, has a fixed mortgage for 30 years, their housing payment, absent things like maybe taxes or condo fees, things like that, will basically stay the same over the course of that 30 years. So if inflation goes up and their wages go up, their housing payment would stay the same. If, housing in that community became more expensive, right, they would pocket all of that earnings to their property. And if they were to get a better job, a higher paying job, they would just pocket all of that difference. Well, unfortunately, the downside of income-based rent is that that is not true for folks who receive HUD assistance. So as your income goes up, you may be at risk, we know, of a benefits cliff where you might lose access to certain benefits. So you may actually lose more than you gain for what you earn. And we're aware of this issue. So to address that, our programs like FSS and Jobs Plus offer different versions of an escrow or a disregard for additional earned income. In the case of FSS, for 5 to 7 years, we would put the money that you earn beyond what it was when you started into an escrow account. And we will have a coach to work with you for those 5 to 7 years to achieve your goals, such as educational goals, employment goals. And at the end of the program, when you finish, you would have access to your escrow with interest that can be used for things like home ownership, to pay off debt, access, maybe higher education, buy a vehicle, whatever it is that you want to do with those funds. Jobs Plus similarly disregards any increase in earnings for the course of 4 years. And that means that, basically your rent effectively, if you don't have other changes in your income, such as unearned income, would stay the same. And so we see that as an incentive, but also we fund through those programs, again, the service coordinators on the ground who work with residents. And so we have, I've helped to, Dr. Wong mentioned our Jobs Plus site in LA, which he visited. And if you ever have the opportunity to visit a site that has Jobs Plus, you'll see that's a multi-million-dollar investment that we make for 4+ years to having a robust resident services staff and presence, to having coaches available to work one-on-one with residents. And there's always a required community match With FSS, we require what we call a program coordinating committee, which is essentially community partners that come together to support the FSS program. So this can be a really great way to leverage what we're offering with funding those service coordinators and offering those rent incentives to be able to reach people in the community. So just because it looks like it's an employment program, I also would encourage folks to think of these as opportunities to reach people to improve their health and well-being. And again, particularly in the case of screening for sickle cell, this is something that, just even raising awareness is something that service coordinators can do, but they often, are not medical professionals and they wouldn't be able to do this on their own. So they really need to partner with you all to get the word out, and ideally have folks like Pamela who are trained as community advocates, community health workers who can get the word out on the ground. So next slide, please. This is just some information about FSS. It's actually not updated for FY24. We're in the middle of our FY24 funding process right now. This is very technical stuff, but folks were asking in the chat, will you have access to the slides? So you might want to come back and look at this. We have a lot of great resources online. You can find online our list of grantees, all of the, at this point, nearly 900 entities that receive funding through this program. They're all listed by state, so you can see where they are, if there's any near where you are, and how you might be able to work with them. We also have recently expanded this program to the multifamily owners that I mentioned earlier, which is that larger pool actually of housing providers that provide affordable housing. And again, the names of those entities are public, and we would encourage folks to look them up to partner with them as well. Next slide. Our Ross program does not have a rent incentive, so it is unique in that regard. But what it does have is a focus area on health. You'll see at the bottom that we ask communities to do a needs assessment and to identify areas of need in their communities when they apply for this grant. 2 of those areas are health and wellness and serving elderly and disabled populations. And so we have many, many programs that have raised their hand to do those specific things. And they can only do so because they're just service coordinators. They're not service providers, by working with folks in community to give access to services. So the Ross program is really ready-made for partnership in this area. And in some sense, because Ross doesn't have an employment sort of component, it's open to everyone in the community, youth, folks who are seniors, really anyone who needs access to services can participate in Ross by just connecting with their Ross service coordinator. So I think this is a great opportunity for partnership. And again, all of our Ross grantees are available online. I'll put some links in the chat as soon as I'm done speaking, and folks hopefully will have a chance to look there to get some more information. Next slide, please. And yes, I will put at the end of the presentation, my contact information is there. So I am on this team and I'm happy to be a point of entry. If anyone ever wants to reach out to maybe connect with, for example, the folks who run the Ross program, those are my colleagues, as well as all of the programs I've mentioned. But the other great place to go, again, is direct to your local housing provider or to your local HUD field office. And the reason for that is, we are a small staff who serves, all of these entities, but at the local level, at the field office level, they actually have larger staff for just that specific area. And they're really the ones who are most familiar with the housing providers and the resources on the ground. Now, I will say one thing about the resources that I'm sharing is these are all for folks who have housing. We know that there's a lot of folks who are unhoused, and there are services and resources for them, often through a continuum of care or a COC. And those programs often, in your area may come under different titles, but they bring together, things like wraparound care, trying to identify shelters and places for people to get supportive housing, and then eventually transition into permanent housing. And oftentimes they need to work with health partners because of the health issues that people may have who have been unhoused. So continuums of care are one place that you can work with if you know that there is a homelessness, population in your community that has sickle cell, or just in general. But also, for folks who are looking to get housing, as Pamela mentioned, there can be challenges with wait lists. And one thing that your local HUD field office can do is maybe help folks identify strategies for obtaining housing assistance sooner rather than later. So one strategy could be, to consider, areas sort of right adjacent to or outside of a major metropolitan area where it might be easier to receive immediate housing assistance, and then, later they can move to where they want to be, or just have better access to information about the length of the wait lists in those different areas, and what sorts of priorities are there, if any are applicable. So very quickly, I'll just talk about Jobs Plus. Even though it is our sort of biggest program on a community level, it's place-based, and as I said, is a multi-year, multi-million-dollar grant. We have a limited number of them, so there's around 50 at any given time. If there is one in your community, it is a great place to partner with. Again, Dr. Wong mentioned in LA, they were able to use the really robust infrastructure that Jobs Plus provides to build a community health worker program. And it just so happened that that program was operational during the pandemic, and they were able to, provide resources, food, access to masks, testing, information about the vaccines, things like laptops for school children who needed to be able to, work remotely, internet hotspots, some of the pandemic area programs that were available, assistance programs, get information out about those. Not everybody has a smartphone or a computer. That is why we have our Connect Home program that I'll talk about in a second. But the Jobs Plus program really is designed for something we call community saturation. And so that means really reaching every single person in the community if possible. And so, if there is a community that has Jobs Plus near you, and you have an identified health need in that community that you want to help address, such as sickle cell, the Jobs Plus program can be a great way of doing that outreach. Again, we see health as a major barrier that folks need to overcome. So health is a partnership opportunity for both sides, but also as a career opportunity for those who get recruited into jobs. Next slide. So the community health worker program that I mentioned, it leveraged Jobs Plus. Jobs Plus, as part of its funding, actually pays for the recruitment and hiring of residents as community advocates, similar to community health workers. You can think of them as ambassadors for the Jobs Plus program. We call them community coaches as the term of art, but really they are folks who are, maybe connectors in their community. If you follow the tipping point, the idea of those connectors, right? That's sort of who these folks are. And we were able to leverage that in LA, and I think it's a really cool model for folks who want to partner with a housing provider and create like a deep and lasting partnership. We did this in 5 different cities: Chicago, Akron, Baltimore, and New Orleans. And in all of those places, we know that this work has continued beyond the grant because both the health partner and the housing provider saw the value in having folks in this role and continue to fund folks in that role. We know it can be challenging. A lot of health providers have barriers to entry. And part of what the Jobs Plus program can do is to work with folks, but also to work with you to identify maybe, if some of those barriers are prohibitive and how maybe you could adjust or even eliminate those, but also they can work with residents to help overcome some of those barriers so that they're employment ready at the time that you're able to work with them. Next slide. So I think I took out the slide on Connect Home, but I will mention that telehealth has been a major area that we've seen, since the pandemic. And the Connect Home program, which is in 100 communities across the country, we're about to have our summit in December, bringing those communities together. And we have a session on health. They are very focused on delivering health resources to folks, in addition to ensuring that everyone has access to affordable, fast internet in the home and to devices that can maximize the use of that internet. So not just a smartphone, but ideally, a computing device, a laptop, a desktop, something that could be used for education, even employment. And, we've seen in many, many cases, telehealth. So that's just a quick overview of our services programs. I'm happy to answer questions. And again, I'll put some information in the chat. Please do. I know my email is a mouthful, but you can also, like I said, just Google a lot of these programs. And even easier is to Google your local HUD field office or your local housing provider. But I'll put some links to our locator tools that, can help you find those directly. But if you don't keep those links, you don't bookmark them, you don't remember them, just know that you can always look us up online. We have these resources that are all available online to help connect with these programs to better serve residents and community. So I'll pause there and see if there are any questions, but also just thank you again for the opportunity to share about these programs. And I think, hopefully Pamela's story has inspired folks to see the power of partnership with these programs to better serve community.
Great. Thank you so much, Jason, for that overview. And just from my perspective, I learned so much over the last 5 years from you. I used to think that HUD just provided housing. I didn't realize there were all these other supports and programs, multi-million-dollar ones like Jobs Plus, that really just all these other issues in terms of improving quality of life of your residents. So really hats off to HUD for all you're doing. And the other take-home message that I got from your talk just now, Jason, was really there's an opportunity for collaboration with Warriors and the CBAs that are on the line, reaching out to your local public housing agency, the PHA, to look for opportunities for sickle cell. So thank you for mentioning that and for being so open to ongoing communication with the community. Go ahead, please continue. We have about 20 minutes for questions. I want to invite Pamela to be back in here in terms of answering some of the questions. And I'll start actually with the question that came in from the registration. What are examples of successful health condition specific housing policies? Well, maybe I'll start with Jason for that.
Yeah, great question. So I mentioned, I'll kind of give a little bit more detail about the HOPWA program, which is housing opportunities for people with AIDS and HIV. So that was a program actually, started decades ago to address the immediate need at the time that, folks who may have had HIV and AIDS were in need of housing and also dealing with a severe medical condition. And so this was sort of created as a way to provide special set-asides so that there was housing available that, they could at least get that housing stability, again, as a way of then accessing health resources. That program still exists. There's also, we have programs, for example, this is not necessarily directly about health, but I'll just mention some other special populations programs. We have programs around foster youth, ensuring that, folks who are transitioning out of the foster care system can have access to affordable housing even as young adults. We have, as I mentioned, the Office of Healthy Homes. And if you are interested in what the Office of Healthy Homes does, I would encourage folks to visit their webpage, check out some of their resources, subscribe to their mailing list. They have oftentimes grants in community that are open to health and housing partners and providers. And those can be opportunities, depending on what that particular grant is for, to actually receive HUD funding to do health-related work. Again, typically around things like asthma prevention for youth or ensuring that folks have a safe and healthy home to live in. There is, I think, a great opportunity. Unfortunately, we do not have like a special set-aside program for sickle cell, but because we know that sickle cell, disproportionately affects people from African descent, and we serve African American in addition to other communities, but generally we actually serve minority communities. If you saw on the slide earlier, the majority of who we serve. And I think that there is an opportunity to work with your local housing provider to maybe talk about whether they would like to have a housing preference for folks to be able to, let's say, jump the waiting list or get early access to housing when available to help them with care and treatment when they have someone in their family that's affected and diagnosed with sickle cell. On a national level, of course, that would have to come down to Congress authorizing a new program for this purpose, but you never know. I mean, this strikes me as something that is incredibly bipartisan. In fact, all of our programs are. And, it generally is the case that diseases don't care about your political preference when picking who they attack, unfortunately. So I would encourage folks to, think about ways that they can raise awareness about this issue with decision makers who may be able to increase access to housing for folks who may unfortunately currently have to wait to access housing until, their name comes up on the waiting list.
Great, thank you, Jason. And I'll just add, when you mentioned about HOPWA, the housing opportunities for persons with AIDS, because of this session, and I learned about HOPWA just over the last couple of weeks from you, Jason. I reached out to some folks who were involved with HOPWA legislation in 1988 to 1990, and we have some documents. I don't think we're able to add attachments to the chat, but we'll be share some of these resources on HOPWA by email later. And I'll be learning more just about the process, about how they advocated, how the community advocated for a HOPWA program, just to see if there are any lessons learned that we can share with our warriors and the CBOs on the line today. So stay tuned for that. Oh, I see, Zainab, thank you for attaching some of those documents. The next question I wanted to ask is also from the registration is, are there any initiatives in place to increase affordable housing options?
Yeah, great question. So I didn't talk about all of our housing programs, but I'll mention we have a sister office called Choice Neighborhoods. Folks who have been maybe involved in the affordable housing space for decades may remember the Hope 6 program from the 90s. There's actually still Hope 6 projects today that are using those funds. But Choice Neighborhoods is a program that is designed around community transformation. Traditionally, public housing was often 100% affordable and 100% residential. And Choice Neighborhoods makes an effort to redevelop communities to be both mixed income and also mixed use. So what that means is integrating market rate units, home ownership units, rental units, and affordable units for folks to be able to come ensure that they can stay in community or come live there if there's extra space. And also to have things like retail, maybe in some cases, like even a grocery store, particularly for places that are in food deserts, health clinics, community centers. And I've seen very many good examples of better integrating the housing that's being redeveloped into the community, whether that's through public transit or just greater intentionality around use of public spaces, recreational centers, and linkages to existing networks like sidewalks, bike trails, things like that. So that's an opportunity. If there is a Choice Neighborhoods redevelopment in your community, that is a great opportunity. They actually have a ton of money. They leverage usually hundreds of millions of dollars, but then anywhere from 7 to 12 or more times match from local and state resources. So one of the key pillars of Choice is to focus on the people and the health and well-being of people. And that is a great opportunity to partner. Again, that's our sister office. I'm always happy to connect folks with them. But really, the best people to reach would be the people on the ground who are running those redevelopments, which is oftentimes, a housing agency, maybe with a redevelopment partner. And you might even see that, right? When you drive by, you might see a big sign that says, this community is being redeveloped with HUD dollars, and it'll give the name of the developer who's doing that. So that can be a great way to reach out. There's other housing programs that we have that sort of transition public housing to a more stable funding platform through something we call RAD. It starts to get very weedy. There's just so many ways that affordable housing is funded, including increasingly by tax credits, which are not actually from HUD, but from the Department of Treasury. But what I can say is that because we work with those housing providers from our Office of Multifamily Housing, so not my office, but again, a sister office, we are able to reach those folks on a nationwide scale, probably better than you may be able to from the outside. So, if you are looking to identify housing opportunities in your area, we have map tools, locator tools. I'll put some links in the chat that you can use to identify those different providers and who to work with. Sometimes you might just have to look them up and go to the website and see if they have something like a resident services director or a resident services department. It might be called different things in different places. You might see, the HUD-Strong Families team. You might even see a community and supportive services team, CSS. They might name it after our office. But you will generally find somebody. And if not, even I sometimes will just call a housing agency and ask, who is it that works with residents to help give them access to local resources, community resources. And even if there isn't somebody that we fund through our grants, there may be somebody who, whether through personal passion or just, as part of their job, serve in that role. By and large, people who serve community are, doing so based on personal passion. And I have found that if you're looking for somebody who's highly motivated to work with you, there's no really better place than a housing provider.
Great answer. Thank you, Jason. So I'm going to ask you one more question that came in live, Jason. And then I also just want to mention to Pamela, the question after that will be to you. We want to learn a little bit more about what you're doing with the FSS program that you're enrolled in. So I know you're having a little bit of challenges with audio, Pamela. I just want to give you a heads up.
Okay.
The live question we have for you, Jim, is from Jim in San Diego. He's a CHW working with the justice involved population. And he wanted to know if there are any HUD programs that are beneficial for that population.
Yeah, great question. So reentry is one area that I think local partnership can be really powerful. I'll put a link to the chat to something that I actually worked on years ago called It Starts With Housing. It's a reentry toolkit that highlights a few examples of how different places in the country were able to serve justice-involved individuals. One way, which I think is very powerful as a model, is New Orleans. They went through a long community engagement process to sort of understand the concerns and needs of the community and to rewrite their housing occupancy policy. We call them ACOPs, but essentially they're the rules for who can live in public and assisted housing. And there's only really two bars to that by statute. One is if you are a registered sex offender, and the other is if you've been convicted of producing methamphetamines in your residence. But beyond that, it's up to local decision making. And so there are a lot of ways that folks have even been able to prioritize folks who have been justice involved, and they've done so generally through community engagement to understand the concerns, but also to help advocate for the benefits in terms of reducing recidivism and also actually reducing things like crime in community. So I will share that resource. There are lots of also, outside organizations that are really invested in this work, like the Vera Institute, for example, just to name one. And, I think a lot of this work happens at the local level, but it can be supported by federal programs. We had a program at one time called JRAP, and it was the Juvenile Reentry Assistance Program, but essentially it helped to fund legal aid lawyers to work with residents to help expunge their records for sort of minor youth offenses. And, I know that those programs exist even outside of, our funding, which unfortunately, we no longer have. So it's a great question. And I know that there is a community of practice around this. So I would encourage you, to maybe reach out to some of your other, sister housing authorities in nearby communities to see if there is a local or state partner who is really active in this work and who may be able to help assist you in coming up with solutions. We don't sort of mandate any solution, but we try to encourage and provide resources for folks to prioritize serving that population if there's community desire to do so.
Great. Thank you, Jason. I'm hearing a lot about partnerships with CBOs, very germane to what we do here at Sickle Cell. And so we'll shift now over to Pamela, if you can get on your audio again, just to learn a little bit more. It sounds like, just to remind folks, you've been in the public housing voucher program since 2003, and then you joined the FSS Family Self-Sufficiency Program that Jason mentioned just in 2018. Could you just talk a little bit about what the FSS program has brought to you?
Okay. Yes, I've been a recipient of the Family Self-Sufficiency Program since 2018. And what we do is set goals. I set goals for myself about 3 or 4 different goals, and one of those goals was to become debt-free and save money, and then to become a first-time home buyer, and to write my personal narrative memoir of my life story. And so they have helped me with the resources to achieve those goals. And I'm in the process of achieving all those goals currently. And when you're on the FSS program, when you're seeking employment also, and if your rent happens to go up because you found a job, some of the money will go into an escrow, and at the end of the year, or at the end of your time frame that you're on the program, say you're on it for like 5 years, well, you can get that money back when you graduate from the program. And that can go toward your choosing. If your goal was to become a first-time home buyer, you can get that money to put towards your closing costs or what have you on your house, or your down payment on your home. And so I've been able to achieve 2 degrees in criminal justice from St. Edward's University here in Austin, Texas. And like I said earlier, I'm considering becoming a first-time home buyer now. And I'm in the process of working on my memoir with my editor. And they will also help me with publishing my book. So it's a really great program. It allows you to set goals for yourself, and they give you the resources to accomplish those goals. And so it's a really great program. It's a really great program, and I'm really thankful for the assistance that I'm receiving.
That's amazing. Congratulations on meeting all of your goals, Pamela, with the assistance of the FSS program. So thank you for sharing that. And thank you so much for sharing your whole story today, from the opening TED Talk and participating in this Q&A as well. We're really grateful that you took the time to do that for the community. And we're just got a couple minutes here. So I just want to give Jason a chance, if he's still there, just to any final words from you, Jason. Thank you, Pamela, for your final words you just shared, and then we'll close out.
Yes, of course. I've been putting a few links into the chat with different locator tools. And, again, I would encourage folks to take a look at those. But I actually don't have like I'm not good about this. I don't have like a secret list or even bookmarks. Whenever I find these tools, I actually just Google them, and it's usually the first result that comes up. So half of the battle is often just knowing the terms. So if you come away with nothing else from this presentation, I hope it's just an understanding of what to look for to help partner with housing providers in your community. And that can be things like looking for a public housing agency or authority. We call them PHAs. It can be looking for a housing choice voucher, also known as Section 8 provider, which sometimes is a city or state or municipal entity, but oftentimes is a PHA. And it can be as easy as connecting with a multifamily provider, which again are sort of nonprofit and private owners. So if you only remember one thing, I hope it's what to Google so that you can find partners on the ground to better serve folks in your community. If you can remember 2 things, I hope it would also be that we have folks on the ground that we help to fund and support that are ready-made partners for you. Their job and role in many cases is to partner with CBOs, health providers, and they're often very eager to do so. They may not know where to find you, but we hope that you take the opportunity to find them And if you can remember a third thing, I hope it's that you know that we are here at the federal level, both at headquarters where I am, but also really at the state field office, local level to help support you. So if you're having a challenge reaching your housing provider, the HUD field office can be a great place to go. And if failing that, you're still having challenges for any reason, you can always feel free to reach out to me. I just want to thank Pamela for sharing her story, and not only for about sickle cell and FSS, but just again about sharing, I think, the importance of working with HUD-assisted communities to address health needs, and to thank Dr. Wong for inviting us here, as always, to continue our great partnership, and most of all to you all as participants for being interested and invested in this topic, and for being curious and wanting to learn more about how you can serve folks who are receiving federal housing assistance. So thank you so much.
Great. Thank you again, everyone. Thank you, Jason. Thank you, Pamela. We can advance to the last slide. I know we're just a minute over, but I just wanted to close out by the next slide, please. Just wanted to share that if you have other questions and comments, feel free to connect with us at SCD at HHS.gov. That's our new resource box that we launched this summer. Of course, we'll answer some of the questions that we didn't get to today, send it out later with some of the other materials. And I wanted everyone on this call to also know that tomorrow we have another engagement. This is a briefing on the new CMS Sickle Cell Disease Provider Toolkit. It's tomorrow from 3:30 to 4 Eastern Time, and you can register using the QR code here. So with that, we've come to the end of this session. I want to thank our presenters again, especially Pamela for sharing her story, being so brave, courageous, and Jason for that excellent overview of HUD. This is really just the start of the conversation. We hope that we'll continue to engage with you on this very important topic moving forward. And with that, I just want to thank all of you for attending today's session, and we'll see you at our next one. Thank you very much. Bye-bye.